What we're aiming for with an ACL reconstruction is to stabilise the knee. So if we can stabilise the knee and their knee doesn't give way on them and therefore doesn't minimises any further damage that they're going to do with the giving way, then we're aiming to get them back to a stable knee at the highest level of function that they can achieve individually.
But what does that mean in terms of actual milestones in your recovery? You will use your crutches until you can walk without a limp, usually 3 to 4 weeks. You'll be able to start driving again when it's comfortable and safe to do so. This may be between 3 to 6 weeks after surgery. Depending on your job, you'll probably need 6 weeks off work. If you do a more physically active job, you'll be off for between 8 to 12 weeks. But of course, all this depends on how you progress as an individual.
Everyone gets a ballpark figure of how we expect them to progress, but no, the physiotherapy programme, the rehabilitation programme is tailored individually to the patient, and every patient is different.
So patients are either seen at 2 or at 6 weeks, and then at 3 months, and at 6 months, and at a year. And it's really important that those appointments are kept such that we can monitor how the patients are doing. In between, they're seeing the physios, and they're having regular physiotherapy sessions, which are quite intensive initially, and then gradually as the knees settle down, the patients are then seen less frequently.
But can you expect to get back to normal after all that physio?
Normal's a funny word, isn't it? And normal is about what's normal for them and what they want to achieve. So we're aiming all the time for their highest possible level of activity that they are capable of achieving. So that varies between patients depending on age, depending on their general activity level, depending on their general fitness, and a lot of it is how their knee was before the operation.
An ACL reconstruction will not make your knee stronger than it was before the injury that ruptured your ACL in the first place. So if you go back to football, have another injury that would rupture a normal ACL, you will rupture the graft. We're not going to make it better, and so you may have to come back if that happens.
So your return to sport has got to be managed properly. You can start swimming after about 6 weeks, but avoid breaststroke. Low-impact aerobics and step can be started at 10 to 12 weeks, on advice from the physio team. And you can start running without turning from 2 to 3 months, as long as the knee doesn't swell.
You go through your physio programme, you progress from an exercise bike to very gently running on a treadmill, perhaps 100 metres, very low energy, low rate, walking, mixing that with walking and running, so very controlled running at 4 months, and then building up your rehab such that you're running comfortably by 5 or 6 months. Professional athletes do sometimes try and get back at 6 months, but even in that situation where it's critical, we know that the re-rupture rate's really high, and we really try and hold everyone back until 9 months before they do any cutting sports, anything where they're pivoting at speed, so football, netball, skiing and so on, preferably a year.
And throughout that process, you will be able to judge your progress through regular contact time with both your physio and your surgeon.
So the physio and the surgeon need to be very coordinated in how the patient's doing and working together to actually get the best result. And good physio is essential.
Patients often come back to us in clinic not believing what the physiotherapist has said, asking for the doctor's clearance to go back driving, back to work, back to sport. We're very happy to do that, but actually the physios see you on a much more regular basis than we do and see many more of you than we do, and believe the physios. They have a lot of experience, particularly if you're coming here for your physiotherapy post-operatively.